chronic disease. What is cancer? Cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. Cancer can start almost anywhere in the human body, which is made up of trillions of cells. Normally, human cells grow and multiply to form new cells as the body needs them. When cells grow old or become damaged, they die, and new cells take their place. Sometimes this orderly process breaks down and abnormal or damaged cells grow and multiply when they should not. These cells may form tumors, which are lumps of tissue. Tumors can be cancerous or not. Types of cancer: bladder cancer, breast cancer, colon and rectal cancer, endometrial cancer, kidney cancer, leukemia cancer, lung cancer, melanoma, non-Hodgkin lymphoma, pancreatic cancer, prostate cancer, thyroid cancer. Causes of cancer: smoking and tobacco, diet and physical activity, sun and other types of radiation, viruses and other infections. Cancer-causing radiation: high-energy radiation such as X-rays, gamma rays, alpha particles, beta particles, and neutrons can damage DNA and cause cancer. These forms of radiation can be released in accidents at nuclear power plants and when atomic weapons are made, tested, or used. Certain medical procedures such as chest X-ray, CT scan, PET scans, and radiation therapy can also cause cell damage that leads to cancer. However, the risk of cancer from these medical procedures are very small, and the benefit from having them is almost always greater than the risk. Cancer-causing chemicals. It is important to be aware that a classification does not necessarily mean that there is a reason to be worried about using a product which contains that substance. Whether or not you will develop cancer will always depend on both dose and exposure. In other words, how much of the substance you are in contact with, how often and in what way. The likelihood of getting cancer from a specific chemical depends on several factors including the type of chemical you were exposed to, how big a dose you were exposed to, how often, when and how you were exposed, how long you were in the chemical for, your gender, health condition and your genes, possible exposure to other substances that can cause cancer. Diagnosis. There is no single test that can accurately diagnose cancer. The complete evaluation of a patient usually requires a thorough history and physical examination along with the diagnostic testing. Many tests are needed to determine whether a person has cancer or if another condition, such as infection, is mimicking the symptoms of cancer. Effective diagnostic testing is used to confirm or eliminate the presence of disease, monitor the disease process, and to plan for and evaluate the effectiveness of treatment. In some cases, it is necessary to repeat testing when a person's condition has changed, if a sample collected was not good quality, or an abnormal test result needs to be confirmed. Cancer diagnosis methods: lab tests, diagnostic imaging, endoscopic exam, genetic tests, tumor biopsy. Treatment. Many procedures and drugs are available to treat cancer, with many more being studied. Some are local treatments like surgery and radiation therapy, which are used to treat a specific tumor or area of the body. Drug treatments such as chemotherapy, immunotherapy, or targeted therapy are often called systemic treatments because they can affect the entire body. Learn about the most common types of treatments for cancer here: surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, stem cell or bone marrow transplant, hormone therapy. Presented by RRI 11th grade.
Good morning everyone, my name is Karthik Gupta. Today I want to discuss on a topic that is cancer. Cancer cells are different because they do not die, they just continue to grow and divide in a disorderly fashion. Cancer can occur at any age, but 67% of cancer deaths occur in people older than 65 years. This is cancer statistics. In this, we can show that cancer is the second most responsible disease for that ratio. Common environmental factors leading to cancer that include tobacco 25 to 30%, diet and obesity 30 to 35%, infection 15 to 20%, and rest others. Radiation stress, lack of physical activity, environmental pollutants causes. Benzene and other chemical decaying excess alcohol, environmental toxins such as certain poisons, mushrooms, a type of poison that live on peanut plants, excessive sunlight, genetic problems of acidity, radiation, viruses, and etc. Common cancer types: bladder cancer, lung cancer, breast cancer, melanoma, colon and rectal cancer, non-Hodgkin lymphoma, endometrial cancer, pancreatic cancer, kidney cancer, prostate cancer, thyroid cancer, and leukemia. Treatment and prevention. Treatment: surgery, chemotherapy, radiation, target cancer treatment, small molecule inhibitors, antibiotics, cell-based immunotherapy, gene therapy. Chemotherapy. Drug used to kill cancer cells disparate some aspects of cell division. Toxic to healthy cells, hair, bone marrow, lymphocytes, and epithelial cells of intestinal lining. Side effects include hair loss, nausea, vomiting, and reduced immune responses. Radiation therapy. High energy rays are used to kill cancer cells. Stop them from growing and dividing. Radiotherapy is a local treatment. It can affect cancer cells only in the treated area. Side effects: tiredness, skin reactions such as rash or redness, and loss of appetite. Preventions: eating a healthy diet, exercising regularly, limiting alcohol, maintaining a healthy weight, minimizing your exposure to radiation and toxic chemicals, not smoking or chewing tobacco, reducing sun exposure, especially if you burn easily. Conclusion: hence, cancer is second leading cause of death following heart disease. One should care about its prevention before the occurrence of disease. By various examination and disease is already exists, then one should go for its regular treatment. Recent treatment mainly includes radiation therapy, cell-based immunotherapy, gene therapy, chemotherapy are most widely used method used for treatment of various types of cancers. Thank you.
Hello everyone, myself Shrestha Yadav. Today I will tell you about cancer. First of all, we must know the meaning of cancer. So, cancer is the uncontrolled growth of abnormal cells which grow anywhere in our body. If we talk about the status of cancer in India, then there are few common cancers in India. For example, esophagus, stomach, and lower respiratory tract. And if we talk about the causes of cancer, then there are few common causes which are chemical or toxic composer exposures. Second is ionizing radiation. Third is pathogens, and fourth is genetics. And if we talk about the treatment of cancer, then the treatments are surgery, radiotherapy, immunotherapy, hormone therapy, chemotherapy, and combination therapy. And if we talk about the nutrients which are needed for the cancer patients, then the essential nutrients contain protein, carbohydrate, fats, and water. Thank you.